Hi, this is Dr. Mike, and today's video is about the pressure points for the fibromyalgia test. And in this video, I'll basically be going through where these pressure points are and the different ways of grading or rating them. And I will also, at the end, be telling you basically how the way they diagnose and consider these pressure points has basically started to change a little bit, just so that you understand the use of these pressure points for the test a little bit better. So before we begin, please note this presentation is not intended to provide individual patient advice, but rather it's a way of providing education about fibromyalgia. If you think you have a condition that's causing you chronic pain, please talk to your doctor and get a proper diagnosis and treatment for it. So what is fibromyalgia? Basically, the primary symptoms of fibromyalgia are pain or tenderness in the muscles, joints, or skin from touch or pressure, severe fatigue, sleep difficulties, memory difficulties, and foggy thinking. And this has basically been defined or distilled down to the four main symptoms of fibromyalgia, which is pain, fatigue, waking unrefreshed, and cognitive symptoms. I'll go more into this at a later stage in some of my other videos. Today we're going to be looking mainly at the pain points of fibromyalgia. So when we're talking about these pain points, it's musculoskeletal pain, meaning related to muscles and bones and physical tissues like connective tissues and these sort of things. And when you put a firm pressure on these or applied to these specific areas, they're often called then tender points or pain points. And you can rate the tenderness from this pressure from mild to severe. So basically in the beginning, when the diagnosis and the condition was defined, which was around 1990, they mapped out 19 tender points, which they noticed were commonly, painful when firm pressure was applied. These points are often bilateral, meaning they're on both sides of the body, as well as front and back. And a lot of the times you can find these tender points upper and lower. And the main point of these tender points is that they want to kind of examine to figure out whether this pain is widespread, meaning it's kind of all over your body. So this was one of the charts that the American College of Rheumatology used. And these little red dots or red points along the body are the points where, your therapist or doctor will apply firm pressure, and then they will note these number of points. They'll get an idea of how severe or how bad they are pain-wise, and then they'll note the number. So previously, if you had more than 11 of these 19 points that were tender, then you were diagnosed with fibromyalgia. And that was called the widespread pain index score, basically. So you would have more than 11 out of 19. So as I mentioned, some of the newer diagnoses and the newer ways of looking at fibromyalgia have changed. And what they've done now is they've incorporated some of the other symptoms into the diagnosis. And this basically goes into the symptom severity scale. So on the right side here, you can see that four main symptoms are listed: fatigue, waking unrefreshed, cognitive symptoms, and somatic symptoms. And then each one of them will be rated from 0 to 3. So with a 0 basically meaning no problems, a 1 being a mild kind of pain, which is slight, mild, or intermittent problems. A moderate is a 2, and severe is a 3. So basically, they would use this to get a kind of a scale or an idea of how bad all the symptoms are put together, and that will give you kind of a value out of 12. And then basically, when they add that score up, the neurodiagnoses would want to see a minimum of 5 out of the 12 for this scoring system. And then they combine that with a widespread pain index, which are the 19 pain points. And then they combine those scores. And generally, they think that you need around 13 or more combined out of 31 to diagnose you with fibromyalgia. So I hope that explains a little bit more to you about the pain points, why and how they use them, and also how some of the diagnosis and diagnostic criteria have changed over the years. Please check out my next video in the series, which goes into the details about the fibromyalgia new blood test. And then you can sign up for my 10-part fibromyalgia mini course. The link will be in the description or in the comment section. And please comment or like, share this video, and subscribe if you're interested in more of this content. So thank you very much and have a good day.